So good afternoon and welcome to a Q&A session sponsored by the North Dakota Department of Health and North Dakota Health Information Network. We have worked with the North Dakota Health Information Network for a while, and so this is a part of our outreach, the Q&A sessions. And so for those of you who have had the opportunity to be with us in prior sessions, then know that these are intended to be brief. We only have 30 minutes, and we do that intentionally so that folks have time to actually do this. Our intent is to provide as much, we hope, helpful information on the topic, and then contacts so that you will have a way to follow up with us and then let you know where we're going to, post information. With that, then I'll go ahead and get started. And today's topic is electronic case reporting, or ECR. You've probably heard a lot about ECR lately. And this is kind of the official definition we have from the CDC, who we are working very closely with on behalf of the North Dakota Department of Health, is the automated generation and transmission of case reports from the electronic health record to public health agencies for review and action. Now, we want to take a moment to clarify that electronic case reporting is not electronic lab reporting. Although we know that they are in many ways similar, they are distinctly different. ELR is the electronic submission of lab reports, and probably everybody on this call understands that. It does identify notifiable conditions from laboratory results that then are sent on to public health. Electronic case reporting has the potential to provide a broader spectrum of data relating to health history, comorbidities, and ultimately will support a more effective public health system. So it's very exciting to embark on this endeavor of implementing electronic case reporting. It actually in many ways pulls a lot of things together to provide the Department of Health in the state of North Dakota a lot of great information. Now, it's very, very important that providers understand ECR is not intended to replace ELR or be a substitute for ELR requirements in any way. These are two distinct electronic public health reporting requirements that actually work very well in tandem. I'm not going to read through all of these slides because I really want to get finished with this high-level information so we have time for questions. So, and please do go ahead and start putting your questions in the chat. We have outreach coordinators monitoring the chat for us, so that would be wonderful. So here's a great slide we borrowed from the CDC that looks at benefits. The number one benefit, of course, to the provider is leveraging their EHR to do this work, so it reduces their administrative burden without disrupting the clinical workflow. Of course, we all know it also fulfills the CMS Promoting Interoperability Program requirement for electronic case reporting. And here's a slide demonstrating the benefits to the public health agency. It accelerates the response. That is probably, of course, I would defer to Ben and Michelle and the Department of Health experts on here. But one of the things that we know, we've all realized through this journey of electronic public health reporting is how it accelerates the response. It accelerates the movement of that data to transmit it to the public health so that they can respond in a much more efficient manner. It also enables bidirectional data exchange, and that's one of the things that we're going to see with electronic case reporting that we've not always seen in the past with reporting is sending information back to the provider. So this is taking it up a level in that providing that information and response back to the provider then gives them information that they can utilize. So here's another slide that we've borrowed from CDC because, again, we want to make sure that we align our efforts with what the CDC is advising, all their guidance. And because, of course, we realize that the vendors, the systems, we all want to comply with these requirements. So this slide is, it is busy, I admit that, but it's actually very informative. There are terms on here that you may not be familiar with. And one of the things that we've talked about is we're probably going to break down this slide and make kind of like a list of terms just to clarify. We see here, you know, that we're going on to the AIMS, excuse me, going on to the AIMS platform and moving on to the Association of Public Health Laboratories. That is the transport, let's say, guide or map or flow of the data. And then the data will move on to public health, but then there'll also be a response back to the EHR. And of course, we are relying heavily on our EHR systems to help facilitate all of this work. So it does get quite complicated, but that's why we're here today, to provide as much information as we can, hopefully answer as many questions as we can. Again, working closely with CDC so that we keep everything in alignment. But that's kind of what we're doing here today. Now, I'm going to hand over a couple of the slides here to a subject matter expert that we have with us. Martha, if you want to take on here, she's going to speak to us about the Promoting Interoperability program.
Thanks, Polly. Yes, the slide that you're viewing at this moment is actually taken from CMS. It's part of the actual regulation. And as you can see, we've listed both the eligible hospital, critical access hospital, as well as the providers' particular pieces that they'll need to meet in order to meet this objective. The eligible provider, now that's whether you're through the traditional MIPS or through APMs. And as you can see, both of them are required to do the electronic case reporting. Now, the most important thing here is to understand that when you go to a test next year for your 2022 performance year, you'll need to state your level of activity. And at the bottom here, we have those 3 levels of activity. The one that right today that we're going to really concentrate on is this active engagement, which means that you fully intend to move forward with submitting electronic case reports. And in doing that, we're going to show you in a couple of slides how to actually go out and register that intent. And then that will allow you to be able to answer yes when you go to a test. The other 2, of course, are the next stages that happen once you become engaged with the North Dakota Department of Health. Then we fully expect that you'll move into the testing and validation and eventually the production once your EHRs are ready to do that. Polly, if you'll go to the next slide.
Yes, ma'am.
On this slide, we are pointing out, though, that there are actually 4 exclusions, but you'll see that we have grayed out 2 of them. And that is because the North Dakota Department of Health, they already have stated that they are ready and they can accept messages. So 2 and 3 are no longer applicable to the state of North Dakota. But number 1 and number 4 might be an exclusion your organization could take. Number 4, I do want to point out, though, is only for the MIPS eligible clinician. It does not apply to the hospitals. So the hospitals will probably rely on having their registration of intent if they're not yet ready to start submitting data. Next slide, please. Now on this slide, we have listed out, and when you get your slide deck, you will be able to actually go through this slide. We've got the links there, and you'll be able to do your registration of intent following these steps. But now I'm going to turn it back over to Polly and Ben from the North Dakota Department of Health, and they're going to actually walk you through what that looks like. Polly?
Yes, ma'am. Okay. Ben?
Yeah, you'll need to click on the website link, Polly.
Okay. Is it not coming up?
No, we're not seeing it.
Not yet. You might need to change screens. Right now we're just on the PowerPoint. Change the screen you're sharing to maybe.
Try it again. So you still can't see it?
No.
No, we're still looking at the PowerPoint.
I will see if I can share quick.
Yeah, I can see it. I just can't. I'll stop presenting then.
Okay, are you able to see on my screen?
Yes.
Yes.
Can you see it now? Okay.
Okay, so this is our electronic case reporting page that's on our website. You can get there either from the link provided or a quick search of keyword of ECR will bring that right up for you. And this is just going to go over some of that brief information about electronic case reporting. But the point we wanted to show here at the bottom is our promoting interoperability program registration. This is where you will go to register intent. And that's going to provide us information about your facility, your contact information, and really let us know where you're at in this process so that we can do our follow-up communication and to get any information that you need out to you. This registration does apply to ELR and syndromic as well. So those are also things to look at if you aren't already. But for this purpose, we would be looking at electronic case reporting. From there, we're just going to ask some basic information about your organization. And then we also are going to ask for a backup project contact if you have one, just so that if you're not available, we also have a secondary means of communication. And then we do have a quick question about whether or not you're working for the vendor or if you are the private provider or facility. And the same for the backup contact. For ECR, you can generally skip this question on transport mechanism. This is generally more for syndromic and ELR. And as was shown earlier, there's some different connection methods available for ECR. And then we just ask for the dates that you're ready to attest for and whether or not you're ready to start onboarding and testing right now. And that is the extent of the form. It's a very quick form, just informational. We just want to get that information from you so that we can communicate to you. And go ahead and fill this out whenever you're ready. And it's fine if you are not ready to start onboarding and testing yet. This is helpful to us to let us know that you're looking at ECR, you're wanting to move forward, even if you're not ready yet, even if your vendor isn't ready yet. We still would love to have you fill out this form so that we can get you into our queue for onboarding and at least get you the communication that we have for you. And I'll turn it back over to Polly.
Okay. Thank you, Ben. Let's see if I can get back in here. This is okay. Okay. Can you all see my slides?
Yes.
Yes.
Yes. Well, thank goodness. Fun with teams. Hey. All righty then. I'll be really quick so that we can move on to questions. But I did want to provide this information, the role that we're playing. By the way, my name is Polly. I'm with Help Tech Solutions. It's a small consulting firm out of Kentucky. We've had the wonderful opportunity to be working in North Dakota for over 4 years now with the Health Information Network and now with the Department of Health. And we're going to be providing provider assistance to the Department of Health and the HIN as we move along with this implementation. So some of the things that we've been working on is a readiness assessment survey. I hope that you have received that and have completed it. If you haven't, you'll be able to click that when you get this slide deck. But we really encourage, one of the priority things that we're working on is to get a status, as Ben was just talking about, where is everybody with, along this spectrum. And then, it's going to be just really important to track progress as we work to accelerate the implementation of electronic case reporting across North Dakota. We'll be providing outreach in the way of education information. The session that we've done today will be tracking implementations. We'll be supporting Ben and Department of Health with the promoting interoperability and mix, and just guiding providers in any way that we can. We can provide some technical assistance related to direct secure messaging and use of the NDHIN HISP, and then just really working through this whole process. The outreach team is with us today. Rachel, Tracy, raise your hands. And here's their information. You'll have this slide deck. I'm hoping that many of you are already familiar with them and with their team and have worked with us with onboarding to the HIN through the years. So we just strongly encourage you to reach out to us. And with that, then I'm going to turn it over for Q&As, and I'm going to, first of all,